So hi there, my name is Alex Carr. I'm the communications coordinator for Lake County, and I'm happy to be joined here by Paul Mazzino, who's the Lake County emergency manager. And so we're lucky to have a couple minutes of his spare time to do this little mini interview that we're doing. He's really busy during these times, so thank you. Because of that, we're going to limit our questions. To keep myself on track, I wrote down about 4 questions that we're going to ask. So let's just kind of get to it. So this building that we're in right now may not be familiar to everyone. So where are we today?
Well, we're sitting in the Emergency Operations Center of Lake County. The facility includes an operating floor with multiple positions for us to have staff come and normally help us. It also includes a policy room, communications center, and we're co-located with the 911 center, so we have the ability to get to emergency communications.
Okay, so in general, so during active emergencies, what does an emergency operations center do? Like, what are our tasks? What are we working on?
Absolutely. Primarily, the Emergency Operations Center is there to coordinate the organization's resources. So in this case, we're going to coordinate Lake County's resources from all the different departments that work within Lake County government to support the incident. And in the case of this episode with COVID-19, we're supporting the health department and their public health operations center over in Waukegan. And we want to make sure that they get all the resource requests that they need filled, that we coordinate all the county actions that make sure that we can support the community. And in addition, in this particular incident, we're supporting county operations as we look to address the governor's stay-at-home order and the changes that means and the number of staff we have available to work.
Yeah, and so one good example, let's kind of make something tangible here. So you hear a lot from the governor's press conference, even the president when they talk a lot about the term PPEs. And we actually have involvement in kind of resourcing and getting that information. Could you explain that a little bit?
Yeah, absolutely. PPE is personal protective equipment. In the case of a pandemic, we're talking about masks, gloves, face shields, gowns and things that not just medical staff, but some of our own staff need in order to be safe as they operate. When people are in need of that equipment and they can't get it on their own, they come to the county. We're talking about the hospitals, we're talking about long-term care facilities, our first responders. Official organizations that need that equipment can come to Lake County government, to the Emergency Operations Center. Then we will evaluate those requests, work with the health department to find sources to fill those, or work with the state and federal government to try to make those requests happen.
Okay, and so normally we're kind of like in a side room right now of our Emergency Operations Center, but normally the main room, we're going to pop it up on the screen right now to show what it looks like right now, but normally the room is packed during emergencies. It's, you really can't fit. We have to limit the amount of people that come in here because so many are responding to emergencies. But in this particular situation, we'll pop up another screen. We just have only a few people in here. But tell us how the EOC is working right now, even though that we're not all in the same room.
So one of the things that we've done over the last few years is invest in technology that allows us to do remote operations. So where we would normally have people in the room so we could talk face to face and we could communicate and work on problems together, we now use a common operating software that allows us to show the situation and what's developing and what we know is going on, as well as to communicate with each other through like instant messaging and email-like communications, as well as we use other technologies like Zoom video and Microsoft Teams and some of these other conferencing tools that allow us to have virtual meetings and virtual operations, still achieving the same effect, but without needing to actually be face-to-face or have this 6 feet of separation.
Yeah, and I could say from our team in communications, we have a bunch of us working on responding to COVID-19, but we've used a ton of like the video communication, everything like that, just to keep that personal touch. And it's great that technology has advanced to that to this point where we can still effectively work. So that's been really nice. So last question, and we know you're busy. Sure. Your team works throughout the year, not just during emergencies. So can you kind of speak to how the Emergency Management Agency plans for how the county responds to events like this.
Sure, absolutely. I mean, one of our primary functions is to do planning, is to write our county emergency operations plan, to coordinate on other people's plans to ensure that they meet some of the requirements and standards that we have, to work with the municipalities as well on their planning, and then coordinate that with the state. Then we develop operating procedures that we would use to implement that plan. We get training programs or execute our own training programs to ensure that everybody knows, what they need to do when it becomes time to operate. And we run exercises off and on throughout the year, or participate in other people's exercises, so that we hone those skills and get a chance to demonstrate what we're capable of.
Yeah, and I could just speak to it too, being part of a number of those exercises. They're really, really helpful for us to just practice and kind of simulate the environment of an active emergency. And so we do that all the time. And Paul and his team really leads that effort for the county. So I guess that's the 4 questions I had. We know you need to get back to work. So thanks, Paul, for joining us, and hopefully you get some sleep sometime soon.
We hope so too. You too, Alex.
Thank you.